My name is Keisha Vines. I'm the engagement specialist at Community Campus Partnerships for Health. Welcome to our third and last session, community forum on co-creating community center emergency action plans, partnering with UNC Chapel Hill. So the community forums will be a platform to increase awareness of emerging pathogen project and to engage community members and organizations in dialogue and actions relevant to preparing for pandemic or emergency pathogens before, during, or after it occurs. So the purpose of these forums is to bolster countries' preparedness and capacity to respond to emerging pathogens during medical and public health emergencies. Next slide, please. So before we get into the session, I want to highlight Community Campus Partnerships for Health. For those who are unfamiliar, we are a small but mighty and nonprofit that promotes health equity and social justice through partnerships between communities and academic institutions. Next slide. So just as an icebreaker, we're asking everyone to please put their name and pronouns in the chat, along with one lesson that you learned about pandemic response. Okay, so we have the importance of putting things in layman terms. Yes, that's very important. Nothing is easy. You gotta learn to adapt. One lesson is to not get behind the 8 ball. Exactly. Okay, we can go to the next slide. So the agenda for today is that our UNC partners are going to go over the RESPECT project. We're going to have a community panel. Then we're going to have an activity explaining the emergency response cycle and having some engagement with you all through the 4 phases of the cycle and community action plans. Okay. Next slide. So the learning objectives first is to describe the role of the UNC Regional Emerging Special Pathogen Treatment Center, also known as the RESPECT sites, and emergency preparedness for emerging pathogens. Also to elicit community leader voices in developing action plans before and during pathogen response. So we're really going to be honing in on communicating with you all, seeking that engagement later on in the presentation about emergency preparedness before, during, and after emergency, the role of community-based organizations, and how to center equity. Okay, next slide. So one of our partners, Dr. David Wall, said, outbreaks begin and end in the community. As we know, the ongoing COVID-19 pandemic has significantly negatively impacted historically marginalized communities, specifically African Americans, in terms of lack of access to life-saving healthcare services like testing, treatments, and vaccines. So I just want you guys to keep this quote in the middle of your head, or at the forefront as we go through the activity and as we listen to the panel speakers as well. Okay, next slide. So as a chat storm, one question I want to pose is that how can we best engage and maintain trust with communities before outbreaks occur? How can we best engage and maintain trust with communities before outbreaks occur? And please put your responses in the chat or come off mute and share your thoughts. I think part of it is just being transparent with the community, with everyone, honestly, with any updated information. During COVID-19, a lot of information was changing, a lot of back and forth that was happening. So transparency and honesty is key when relaying information to the community. Dr. Phillips said, have a relationship with the community from the start to build trust. Yes. Brooks said, I think we need to be engaged with communities at all times and not just during a crisis or emergency. Yes. We don't want to come in just when an emergency happens and try to help. We want to establish a relationship beforehand and try to sustain and change what's going on before an emergency occurs. Constantly build relationships prior to any type of event. Yes. Thank you guys for sharing. Next slide. I'll pass it on to the UNC team to talk about the respect sites.
Wonderful, Casey, and thank you very much. So my name is David Wall, and you saw that quote from me and my colleague Billy Fisher, and we mean it. So I think this is really a great opportunity for us to talk to folks and get a sense from them during the rest of this call, what you all think we should do. My part, along with Brooke, who's also on the call, is to give you guys a little bit of an understanding of what this is about and why we've convened these fora, to try to understand more about what people's experience have been during previous outbreaks, especially COVID and more recently Mpox. But to tell you a little bit about what we're doing, our goal is that more and more people know about what we're doing, so that if there is a crisis, a health crisis, a public health outbreak, people are aware of what we're doing, and people are aware that there is informed directions that we're taking from major stakeholders from the community to help guide our work. So we'll talk about these regional emerging special pathogen treatment centers. So these are centers that are, and I'll show you a map on across the country. These are centers that are designed to provide hubs for clinical care of people with special diseases. So you can see all the stars across the country, and they're pretty well distributed. There's obviously some gaps, but there's distribution across the country. And it used to be there were about 10 centers, and then more recently, it was expanded to 13 centers, and UNC here in Chapel Hill was chosen to be one of these centers. So this would be somebody who comes down with a really bad infection, let's say abroad, or even here in the United States, and would be cared for here. The buck stops there. There's nowhere else to send people. So they might go to another hospital and then be transferred to our center. But this is it. And we're expected to be able to take care of that person, whether it be a missionary working in West Africa, or a healthcare worker, or someone who catches infection X here, a new emerging infection that maybe we didn't know about, or is just emerging. So we're supposed to be able to provide state-of-the-art clinical care for all walks of life across the entire lifespan of people, from babies to the super old, people who are pregnant, people who are breastfeeding, people who are healthy, people who are not healthy. And in North Carolina, where you can see the yellow star, that's where we are. We're fortunate to be partnering in our region with Emory, and Emory's got a head start on this. It's been mentoring us to do this. One thing we felt really important in creating this center was being able to have good bi-directional communication with the communities we serve. Now, there's a lot of communities in that blue region of the country, and it's impossible to communicate with everyone. So we're very interested in working occasionally our team to reach out to the super influencers, not just the influencers, but the super influencers who can help us really get the word out there and us get the word back to us. A lot of what we're also doing during peacetime, as we call it, while there is no outbreak, is training others. That means training other hospitals, training providers, even within our own center, and Brooke spends a lot of time on that, and educating the public. We want to be able to disseminate good information that's reliable and trustworthy to cut through what often is a cloud of misinformation, of information that is harmful. So we want to be a trusted resource, and we want to be able to find ways that we can communicate with people that it's easy for them to access, easy for them to understand in languages that they prefer. So we're working on all these things. They're all aspiration, but we learned a lot during COVID, and we're going to hear from you about what you learned during COVID that have helped us understand some of the things not to do and some of the things to do. again, if this is going to be in this community, we don't want there to be folks nearby who say, well, wait a second, I didn't know you were going to take care of Ebola patients here in Chattanooga. I didn't know you were going to have somebody from, another country come here with infection X. I'm scared. So we can make sure people know about things, because people fear what they don't know. And the more they know and the more they understand, and we understand how people want us to communicate and be as transparent as possible with them, the more we can. So that gives you, I think, an overall sense, and I'll let Brooke add other things that I may have left out as we think about, again, why we're doing this, why we're talking to people just like you, and what we're asking from you, which is to share your experiences and your perspective, but also at the end of the day, what we're hoping to do is understand a roadmap that we should take as we engage with communities that we serve. Brooke, do you have anything that you want to add to that?
Sorry, my mouse couldn't find the mute button. You'd figure after a few years I'd know exactly what it is. No, I think you hit everything right on the head. I mean, we're really building a program here that's not just UNC centric. It really involves the region, which is healthcare providers, frontline providers throughout the region, but also, like we're here talking to you all today, our community members also, because you're such a big part of our program, and it's our community who are going to be talking with and treating at some point. So it's really important that we have your input on how we appropriately build programs and get out there and talk to everybody and train and educate out in the community. Thank you.
Thanks, Brooke. Keisha, we'll turn it back over to you. Thank you.
Great. Thank you so much for sharing that information. So next we're going to move into our community panel. So our first guest speaker is Yvonka Marie Hall. She's an activist, deeply impassioned and involved in social justice activities locally and nationally. She is currently working on a number of initiatives, including a ban on methanol products, healthy menu options, and implementing anti-racist and hospital setting policies. Her work is designed to address equity issues in the community and highlight the need for policy and calls to declare racism as a public health crisis. Next, we have Dr. Ruth Phillips. She's an executive director for the Community Health Coalition in Durham, North Carolina. Dr. Ruth and her team are boots on the ground, meeting people where they are, addressing food insecurity, chronic disease, health prevention and control, health education, advocacy, and literacy. Next, we have Joseph Fox. Dr. Fox is a lifelong educator, mentor, and community advocate. He has advocated for students up at Dr. Hugh for more than 30 years in his role as a community college instructor, as well as his role as a former department chair of business administration at Asheville Buncombe Technical Community College. And lastly, we have Mavis Hill, who is an executive director for the Tyrrell County Community Development Corporation. Apart from professional work, Mavis is an active member of the St. John Missionary Baptist Church. Within the church, she serves in various roles, including the president of the Missionary Auxiliary, church clerk, secretary, historian, and as a member of the finance committee. So thank you guys for joining us today, and I'll let you guys introduce yourselves further and talk more about yourself and your organization.
Okay. Let me pull up my screen. I think it's, did it come up?
Are you trying to share your screen?
I think I cannot do the screen because you're on the screen. It says I cannot start the screen share while another participant is sharing.
Okay, Sharice, can you unshare your screen or
Yes,
okay.
sorry about that. Try now.
That's okay. All right. So the Northeast Ohio Black Health Coalition works to effectively engage the African American community during a time of crisis. And so part of the work that we do is working to educate and advocate for the community. For us, it's more than just dropping in, because we see a lot of agencies and a lot of programs that kind of like show up out of nowhere when they haven't been there when the community is most at need. Our mission is to create equity in the African American community, addressing the cumulative impact of racial, economic, environmental, and social justice inequities in education, employment, housing, and health by working to educate, advocate for, and empower the community. We take that seriously. So in COVID, if you look at all of this mirage of pictures, this was us, boots on the ground, making sure that we had food for the community, that we offered vaccinations for the community. We had a COVID support group. And for the food piece for the community, that was very important because at the beginning, when they announced that schools would be closing, one of the things that was important to our group was how would we make sure the disabled children and their families, because usually with disabled children, a lot of them are being raised by caregivers, elderly caregivers. How will we make sure that their parents and the children are safe? And so we called the schools and said, so what are you going to do for kids who can not get to your facility to get food? And the answer back from the school district that's responsible for feeding and educating our children was, we're not going to do anything. They need to get to us the best way they can. Absolutely ridiculous. And so what we did was we instituted a food program. I took $10,000 from my personal credit card and started buying food for the community. So if you look at the middle picture, that is some of the bags that went out to the community. Those going all the way across would be the bag that the family would get. All of those bags going crosswise were what they got. So what we did was we made sure that families got food according to how many members were in their family. So they didn't just get a box like what they normally get at the food bank. What we did was, if you have 10 children, we gave you enough for you and 10 children to have enough food for the month. If you had one child, you got enough for that one child and yourself. And so looking at that, we had volunteers that came out and loaded up the cars. The one picture is cars coming into the driveway. They came in two at a time. We loaded them up. Our volunteers, about hundreds of volunteers came out. Cars were lined up down the street of people who I had never met before in my life. We put out a call to action and people showed up and showed out. We gave them the address so that they were delivering to, many in neighborhoods they had never been into before. And they delivered. We never had one bag, not one single bag disappear, where it was someone who didn't belong to the program or wasn't part of the program, or someone just pulled up and took someone else's food. That never happened. And then with our vaccination clinic, we partnered with some of the medical centers that are in the community. And then when they weren't able to accommodate, we actually went to the pharmacy, which was Medic Drug Mart, actually sent their staff to provide the screenings. We vaccinated 1,000 people at our vaccination clinics. We also put up billboards around the community around vaccinating up against COVID and the flu. And it was mask up, back up, wash up, and roll up. It's the right thing to do. And so we called it our UPS campaign. And so we put those out in our community so that people would know that it was important for them to be vaccinated. This is a picture of some of our volunteers standing by my back door. This is my house. We sent out about 250,000 meals from my house to the community members, but we also send out PPE equipment. We send out boots and gloves and hats, all of the things that people needed in order for them to stay safe in place. And we also started a COVID support group because we lost so many people to COVID. So that was important for us to have a support group. For us, we knew that African Americans were disproportionately impacted by COVID, more likely to die with COVID, and our children were more likely to be orphaned by COVID. And so we took that seriously. And now we have lots of people who are long haulers. So for us, the current trauma is making sure that we're addressing the unique needs right after COVID on our community and making sure that people are getting what they need in our communities. And the other part for us that's important is looking at structural racism and the role that it played in the COVID relief efforts, because it is alive and well. And every single facet in our communities are built on structural racism. And we had to dig through all of that in order to service our community. Our ultimate goal is equity, looking at equity for our community and making sure that we get it to our community and understanding who our community trusted. And for us, they trusted us. And so Toni Morrison put it this way. She said, racism will disappear when it's no longer profitable and no longer psychologically useful. When that happens, it'll be gone. And so for us, this work has been important to the work to address the needs of the African American community. And thank you for your time.
Thank you for sharing that, Yvonka. That was really insightful. Let's see, Dr. Phillips, do you want to go next?
I sure can. And if I can share my screen, I only have 3 slides though.
Yeah, go ahead.
Okay. All right, see if I can do that really quick. I think this is it. There you go. All right, so Community Health Coalition has been around since 1989. And our focus normally has been health equity, food insecurity for those marginalized individuals in Durham and surrounding counties, looking at health literacy, being advocates, helping people to be advocates for their own health and well-being. And so that's the space that typically Community Health Coalition has been. I can tell you when COVID-19 started, we pivoted like many other organizations. And one of the things that we had to help with was food insecurity. We found a lot of people that were food insecure and didn't know where their next meal was going to go. And so we had to pivot like many of our organizations. And so we also realized that during COVID-19, people stopped getting their screenings, stopped getting their cancer screenings, their mammograms, their, checking their high blood pressure and cholesterol. And so we were still going into buildings that will have us to make sure we do those screenings for our community. We have a large senior population. We have a large African-American population that we help. One of the other large things that we had to do was to inform our community, to help them understand what COVID-19 was. Yes, go ahead and take the vaccine. And luckily for us, because we've been in the community for 30 years, they listened to us. And an example would be that one of the large hospitals in the area had vaccines and could not get people of color to get the vaccinations. And so they called upon us and said, hey, you know what? People aren't going to come if they see our name, but if they see your name, they'll come out. And they did. And so we were able to set up satellite areas to get people vaccinated, to have doctors on site for any questions anybody would have around the vaccine. And we wanted people to be comfortable. I always say that the beautiful, the most horrific thing that COVID-19 did for us was we lost a lot of people unnecessarily. We lost hundreds of thousands of people unnecessarily. The beautiful thing about it is that it did shine a light on health equity. For many of us who work in this space, we know, and we still know, there are a lot of inequities and social determinants of health that impact health. But COVID-19 really shed a light on that. And so you can't unring a bell. It's there, it's here, you can't ignore it. So I think that's the beautiful thing that COVID-19 has shown us, that, hey, it's here, we have to help people, and there are inequities. The other beautiful thing it shares is that you can't do this without the community connection. And I think that is a big boost for communities, community-based organizations. And because sometimes we're very small, but we were very powerful when getting to those people that were hard to find, hard to reach. So some of the areas that Community Health Coalition focuses on is chronic disease awareness and prevention of diabetes, hypertension, cancer, and heart disease, decreasing obesity, and constantly educating our community about their own health and well-being, addressing food insecurity, and again, providing COVID-19 education, debunking those myths that came about. The other statewide initiative that we're doing now is school meals for all. So the initiative is that and there's a QR code, so if you want to sign a letter of support, please go ahead and do so. And this initiative is for K through 12, all public school students K through 12 will be provided a breakfast and lunch at no cost to them or their families. across the entire state of North Carolina. And so that's what we're working on now. Food insecurity is still very big. Even after the COVID-19 pandemic, I still think we're still in it, but even after they lifted the pandemic, there's so many people who are still food insecure. That number didn't change for us. If anything, it may have gone up some. So those are a few things that Community Health Coalition is doing. And I will leave you with my motto, which is I live with life, which is to listen, to investigate, to follow up and engage, listen to the community, hear what they have to say, and then just don't listen, investigate, and then follow up and always be engaging. And so that's my motto. And thank you.
Thank you so much. Great sharing. Thank you. Mavis, would you like to go now? You're on mute.
Okay. Tyrrell County Community Development Corporation was implemented in 1992. And our initial goal was to work with the people around youth development, workforce development. We later started our health and wellness program. So we started it prior to the pandemic. So once we got that started, we were serving counties who were having difficulties finding masks and getting hand sanitizer because people had just gone in and just bought everything up. So we partnered with the agency where we bought in a truckload of PPE and was able to distribute that in Eastern North Carolina across 4 or 5 counties. We also implemented workshops because there was a lot of talk back and forth. Should we get the shot or should we not get the shot? So we work with the churches, local churches, to educate the people in the church. We also serve the senior population because so that some didn't have family members that could get out and pick up supplies for them at the grocery stores or at the farm, pick up their medicine at the pharmacy. So we also implemented, we built in unique connections that we had never built before with one of our partners that is a longstanding partner now, is Agape. And I would like to share the video. I did have PowerPoint, but I ditched that to elect to share the video that we used. It is really touching. So let's see. I can share screen. Ooh, let me see. Okay, now. You think I will have this down by now? And okay. Now, well, it looks like I'm gonna have a couple of challenges trying to get it to come up. Well, I guess my computer is not being cooperative today. But rather than take up so much time trying to get it work, I'll share the story with you. What it is, one of our colleagues, she had a sister in New York when the COVID hit. She was a nurse and she came down with COVID and she died from COVID 2 days after her birthday. She also had a second sister in North Carolina, in the Washington County area, who contracted COVID and also passed from COVID. And so that particular video we would show to the different community folk and tell them about the importance, because she shares in a video how important it is to get the vaccine and to get boosted. And she puts out a plea, so if you don't want to do it yourself, do it for your family, to protect your family from what they are, what to keep them from going through, being sick from COVID. So we did a lot of work around, educating and sharing that video and putting it up on our Facebook page, and just to educate the community, because I even had, with my board of directors, I had a couple of people on my board that did not want us to do this type of work, or in other words, put out and say, to make a stand on supporting the vaccine. But the overall board said, no, this is important. So thank goodness they outruled the couple of board members who was trying to be in opposition, but now are currently no longer on our board, which is wonderful. But so it was extremely, being in Eastern North Carolina with all the issues that we deal with, it was a challenge. As someone announced previously, that, when the COVID came along, it just uncovered what we already knew with the issues of poverty that exist in our community. One of the things that was shared with us that I read recently from USDA, there's 28 persistently poverty counties, child poverty counties in North Carolina. Of that 28, 24 of those counties exist in Eastern North Carolina. So if those 24 counties would come together to make up their own state, they would be the poorest state in the United States. Thank you.
Thank you so much for sharing. Joseph, would you like to share as well?
Sure. I bring you greetings from Western North Carolina, the other end of the state. I'm in the Asheville Black Mountain area. And Fox Management Corporation, we started our outreach several years ago, quite a few years ago. The actual business started in the early 90s as I was teaching at various community colleges and a couple universities. And our focus has always been equity. And so at the time that COVID hit, I was working with our local MLK Association of Asheville and Buncombe County on the lynching project, AKA the Remembrance Project, with the Equal Justice Initiative, and planning to take a group to Montgomery. We were doing the soil collection project, the racial justice essay contest with high school kids, as well as erecting 3 historical markers for 3 young men that were lynched in Buncombe County, North Carolina, shortly after the Civil War. And so we kind of fell into the equity piece of educating community partners that we were already working with. We were working with ABIFA, which is the Asheville Buncombe Institute in Parity Achievement, community health workers, and participated in their Rooted in Wellness. And from previous work that we were doing with faith-based organization, I'm part of the Christian Methodist Episcopal Church, and had been a director of Christian education and formation for our district, which is 30 churches. And then the region is another 95 churches. And so during COVID, our organization helped churches write their COVID protocol around hybrid services or continuing their full service. A lot of our churches actually closed down during COVID. So we helped them around streaming their services. And then as we started to come out of the pandemic, we helped several churches rewrite their reopening COVID procedures. We also worked with our MLK Association in creating a newsletter where we pivoted from face-to-face meeting doing the Remembrance Project and our community partners, and started including COVID-19 information from various sources and links, etc. And at that time, I became a community response team member, and we helped develop a coloring book for kids that we then assembled throughout all of our community centers here in Buncombe County, as well as our community centers, African-American community centers in Polk County, and then with our faith-based organization. We have continued to provide that support for a lot of the faith-based organizations that we work with, as well as other nonprofits throughout Buncombe County and Polk County. I'm also a business coach for an organization, a micro lending organization, Mountain Biz Work. And so we helped our local business community pivot during COVID-19 to look at ways to either keep their doors open or pivoted to online markets, or some of our local restaurants and food trucks went to delivery only services or takeout only services. And so Fox Management Consulting has just really expanded what we initially did around HR compliance and EEOC compliance to do more with our wellness community. So thank you.
Thank you for sharing that. So we're going to get into some questions, and feel free to come off mute if you have any thoughts or ideas, and we encourage the audience to also put in questions and share your thoughts as well. So the first question is, in what ways did you try to gather accurate information, reduce the spread of COVID-19, and provide truthful information to other organizations, partners, and community members?
One of the things we did, and this is Yvonka Hall with the Northeast Ohio Black Health Coalition in Cleveland. I don't know about y'all, but the initial data was no data. And so I actually have a research team, a research person that works for me, and I have 2 researchers on my team. And we actually sat and combed through zip code data one night until about 2 o'clock in the morning to figure out where the hardest hit areas were, so that we could actually write a press release and to send out to the community and to the press to let them know why it was important for people to, because the vaccination wasn't available then, why it was important for people to wear masks, because that was one of the, getting people to wear masks was really hard too in the beginning. Part of it was because of the access, we didn't have, our, and I talked about this the other day, it's like our government shut down. Even our local government. So where they should have been out passing out masks to the constituents in the communities, that wasn't happening. And so we were doing that work. And if people didn't have masks, they were selling them at the corner store, but they were very expensive. So we were trying to help people to not share masks, which we saw a lot of it happening early on. And so we started to make sure that that we literally probably sent out maybe 1 million masks from here, because we wanted to make sure that people received enough masks so that they would not have to share, that they had more than enough for adequate use for their families. And so that was, one of the biggies in the very beginning is access, making sure that the community that didn't have access, that we were able to provide them with the things that they needed.
I would add, we worked very closely with our Department of Public Health. I'm in Durham, North Carolina, and so we made sure that we spoke the common language. And then we also made sure that language was easy to read and understand. And so health literacy for us in COVID-19 literacy was really important. And so we didn't assume anybody knew anything. What we did, we broke everything down to the very basics. What is COVID-19? What is, virus? What does that mean? We really started from the very basics to give people an understanding of what was happening. And so they can have a an informed decision about their health and well-being. But I think one of the biggest things that we did was really, really educate our community. And we also partner with our faith-based organizations, because we also found out that the faith-based organizations move mountains, literally. And so they were a huge partner in us trying to make sure we got the information for people to understand, but also get the information to people who needed to see it. So echoing what Yvonka said, but that's also what we did too.
And I'll just piggyback off of that and say that we also tried to pull data from trustworthy sites and sites where you saw people that look like you that were presenting that data. So we pulled data from the Black Doctors Associations, the North Carolina Black Alliance. We did also pull data from our Buncombe and Polk counties, Health and Human Services, and relied heavily on our faith-based community to really get the word out there. We tried to put everything in layman's terms. And as I mentioned, our community response team did work with a storyteller, an African-American female, to create a coloring book, to put it in really children language. And we probably we got out maybe 4,000 or 5,000 coloring books throughout North Carolina through our partnerships, and that really started the dialogue. And the other thing we did is we tried to pull what we call our series North Carolina Heroes. So anyone in North Carolina in the medical field, Dr. Kinsey, for example, Ernest Grant, who is actually from this Asheville area, had done some PR commercials around COVID-19, what it is. And so we tried to use as many local people that were in the news that we knew our community would engage with and believe.
Thanks. Thank you. I used to work with his Grant. He is fantastic. I was just reading the chat. Great. Thank you guys for sharing. Mavis, do you have something to say?
Well, I was just share. We had some of the same challenges as the other three, but our biggest piece was being in such a limited resource community. Our source of data was coming from the Department of Health and Human Services, and just basically using the data and as Mr. Fox was saying, and putting it in layman's terms so people could understand what they were reading either from their cell phone or on the website or whatever the case may be. And also, and I wish I could get my be able to share the video, Miss Joyce Holloway. She's a resident of Washington County that lost her two sisters, and her husband is from neighboring Tyrrell County, and they're very well respected in the community. So them sharing their story made, and her sharing her story about her sisters made a tremendous impact. We also, one of the other things that we did was to get people to come out. I'm not a huge proponent of fried fish, but we did two vaccine fish fries. We had one at a local church way out in the middle of nowhere. And believe it or not, there was more people at that local church that showed up to get their vaccine or to get their booster, and they enjoyed a fish dinner. We had Agape Health Services with their mobile unit. And so we were able to give out all different types of information. We also were able to give away additional masks and hand sanitizer. When we got the mask and hand sanitizer, we leaned heavily on the churches and asked the churches to just roll up and load the truck up with mask and hand sanitizer, take it back to the church and distribute it to the people in the community.
No, okay. Thank you for sharing that. As was discussed earlier, as everyone was introducing themselves, I want to come back to the topic of equity and community partnership and community engagement. So how important is it to center equity in your work and placing CBOs at the forefront of your work as well?
For Tyrrell County, most of the people of color and low-income people do not trust county government, and they have a reason for not being able to trust. So it was very important that Tyrrell County CDC was stepped out to the forefront. And as someone was saying earlier, that government just closed down, and they should have been involved in making sure that the community had what it needed, but they were missing. So it was important that we stepped up and that we were able to meet the people where they were at and to get them what they needed. We had one during the pandemic, we had one gentleman to come home from, he was incarcerated. He had 18 cents in his pocket and the clothes on his back. That's all he had. The CDC reached out through Facebook, to sororities and fraternities, to the community. So when that gentleman arrived, we put him up in a hotel with funding with another partner with Community Success Initiative. And when he arrived at the hotel, there was food, there was clothing, there was a warm place for him to stay. And, the community during this time really, stepped forward to be able to help each other out.
Yeah, I do resonate with that. Especially with the community, like you said, helping each other out and really honing in to kind of like it takes a village to,
Yes.
be successful or to take care of one another and to support one another. And through COVID-19 or any emergency that happens, really leaning on your community members, your neighbors, your residents to really support you through those times, and supporting community organizations that are addressing the needs of the community specifically. So I do resonate with that. Anyone else
Yeah,
want
and
to
I
touch on? Okay.
think for us, the whole thing around equity, of why looking at the social determinants of health, which, our organization, that looking at the whole educational system, our employment system. I mean, we had breakdown. We had essential workers that were mainly, they look like us, who all of a sudden had no income. And it's, how do you make sure that people have no income and they're able to get the things they need? The other thing that I didn't list, on there, or didn't show it in the slide, was that we actually had 100 people that we paid their rent for the whole year, because one of the things that happened is that HUD all of a sudden went up on the rent for low income residents. So we had a whole group of people that were going to lose their housing because they could not work. And we had a government structure that had just totally broken down. So we made sure that their rent was paid, because most of them that were in HUD housing were moms and children. And a lot of their children were disabled. They were at home with disabled children. And just looking at, we have these systems that talk about equity. And at the same time, we had everyone saying, oh, we're declaring racism as a public health crisis. And I'm like, do you understand what the crisis really is? Because to do a declaration on paper and not do anything in practice, for our community, it didn't help. And so for us, we wanted to make sure that we were a lifeline to people who were in need. We started the Babies and Brunch program, and then we had people who had children who were not in school and who were essential workers who lost their work. And so we had Meals for Mama. And then we had people who were not seniors, and so they didn't qualify for Meals on Wheels because they were delivering hope. Like, these were things that African Americans have had to do all the time, is wing it, create something out of nothing immediately to get to the unique needs of the communities. And I think for all of you all in our organization, that's what we did. We created something from nothing immediately to address the needs of our communities. And we knew that afterwards we couldn't end it. I mean, we have to still, we're still sending families COVID packages because we still have families that are disproportionately impacted by COVID. You know, I had a family last week, the whole family at home with COVID. If you can't leave out and to go get the things you need, you know, they're calling me. And so what these systems don't understand is that we still have CBOs that are still providing direct services to communities. That's true equity, is giving people what they need when they need it, not saying, oh, well, let me go figure out who does whatever. It's like, I'm gonna do it right here. And so that was important to our communities.
Yes, I love that. Thank you for sharing that. I think, yeah, just centering equity and, like you said, giving people what they need when they need it, having them identify what their needs are rather than us coming in or other folks from the outside coming in and saying, okay, this is what you need. Have them be at that forefront and voice their concerns and issues, and to really center equity in the work that in every step of the process. So I really applaud that.
I'll just piggyback on that also and say that when we were looking at equity, we said, you know, where's the gaps? And the gaps for us in Polk County and Buncombe County was that our community wasn't getting the information that they needed around getting tested, around you know, protective equipment, etc. And so one of the things we did early was we reached out to an African-American female influence. She owns an organization called Equity Over Everything. And she also has a web-based talk show called the Asheville View. And so we pulled together a panelist of local community leaders, medical professionals, individuals that were doctors to discuss COVID-19 in its early days, to get the information out to the community. And I think that was one of our most successful strategies. She has a huge national following, not just Western North Carolina. And so going on the Astral View with Equity Over Everything really gave us some information to give to our communities. And then we shared as many websites for folks as possible. And then we again turned to when the COVID relief funding started coming down through the pipeline in terms of equity, we really fought to try to get some of that money going into our local communities and not to government officials to pay for police salaries, etc., when people were in need for paying their rent, buying food, obtaining masks. And so we were really trying to do it on two fronts, the government funding that was coming down, but also getting the correct information to the community.
I know one of the things that we've also did, we developed the African American COVID-19 Task Force, and that was a resource of community-based organizations and doctors. We all came together just to make sure we were all talking the same language. So when we pushed that information out to communities, we spoke the same language. And we were in Durham, we were in rural areas in North Carolina, but we all came together to collectively, you know, help those marginalized communities in North Carolina. And I thought it was a great way of making sure that we stay consistent with the message and with the language. And so there was no missing of the information or messing with the information or mixing up with the information. And so, and there were some faith-based organizations on there as well. So it's one of the things I think that we did really well to address equity, but also address the COVID-19 pandemic in a very uniform way.
You saw that a lot where there was a lot of misinformation or disinformation going around, a lot of back and forth, and then accurate information not being translated back to the community. And so I think that made a lot of community members who were already on the fence about the vaccine and COVID-19 just kind of go on the opposite end because of a lot of back and forth information that was presented in the media and on the news. So having, that transparent information, having the same language, or even emphasizing language equity to community members is really vital when faced with an emergency.
That was important because, like at the beginning of COVID, it was like so much misinformation all the way through COVID, and there's still so much misinformation. But one of the things was about, I just remember this. So it was two things that stood out. One of them was about cigarette smoking. And it came out with, if you smoke cigarettes, smoking kills COVID. And so we came out with an ad that we put in the community that said, smoking won't kill COVID, but it will kill you. So because this all of a sudden, if you look at the data, the amount of cigarettes that were sold in our community dramatically increased during COVID. At the height of COVID, cigarette smoking shot up. And it was because, remember, we have people who are tied to their phones. So you're receiving all this misinformation on social media, and you're spreading it to other people like, yeah, I saw this. So what you're doing is in real time, you're sending out misinformation to everybody that's on your list. And so we got people that are attached to thousands of folks. And so it's just like wildfire. And then the other one was around Mexican rum, Jamaican rum. So the other one was, if you drank Jamaican rum would kill COVID. So what happened is there was a run on the liquor stores. And so all of a sudden we saw this whole increase in drinking. And it was okay, so we need to address these issues. And so just trying to make sure that for everything that was coming out that was misinformation and disinformation, that we were backing it with the right information. Like, let's get the right information to people that need it, because we had the wrong information coming from the highest office in the nation. And so because of that, we had a lot of people who weren't part of MAGA who were really listening to that message. And I'm like, look, let's not listen to that message. That is not a message that's going to save lives. And then for us, for me personally, I lost 65 friends through COVID before we had a vaccination that was available. So people I graduated from high school in 1986. So people who came out of school the year before me and the year after me were just dropping. We had neighbors who they were talking across the fence. One died one day, the other one died the next day. And we were just losing people left and right. And I think the mental health strain, and for us, that's one of the reasons why we started the support group, because it wasn't just for people with COVID, it was for people who lost folks with COVID. So we had all of this misinformation, and we wanted to bring into a space where we're guessing to what everybody else is telling me here. I think everybody else tried to do the same thing, make sure that people got the right information, because I'm telling you, even today, our numbers right now for COVID are absolutely ridiculous. Like last week, and these are the people that are testing. Remember, testing is still not readily available in our community. And so last week in the state of Ohio, our numbers were at 6,000. So those are people that took a test. So what about the people who didn't take a test, which is probably the large majority of our communities? So, how rampant is COVID going on right now in our community, and how many people who weren't vaccinated are still dying as a direct result of COVID and COVID-related illnesses?
I think for me, one of those mistruths that I will never forget is a young lady said to me, well, I don't want to get the vaccine because they can track me. And I simply said, well, do you have a phone? And she said, well, yeah. I said, you're being tracked. So it has nothing to do with COVID-19, but that was out there and people were believing that. And the information really had to be on point, and we really had to push. We had a lot to we were up against the wall really when it came to information and pushing it and making sure people understood it. When we had our COVID-19 events, we had doctors and pharmacists out there ask me a question just in case, you know, someone wasn't quite sure and wasn't ready, and not even talk about the trust factor in getting a vaccine when people say, oh, it was done too quickly, I don't trust it. So that was another barrier, that trying to get people to trust getting a vaccine that wasn't readily available at first, and now it's available, and so I should trust it. And believe me, um, all the things that were done to particularly African Americans, I heard about it. I heard about the Henrietta Lacks. I heard about the Tuskegee experiment. I heard about so many processes that happened to African Americans that were so unfair, and that really stopped people from wanting to move forward in getting a vaccine. That nope, I don't want it. You know, my mother was one of them. No, I don't want to get the vaccine. I said, well, then show me where your papers are, because you're high risk. And then
Right.
I was called mean. But this is what I was up against, not just with my with the community, but also right in my own family. So it was very real. It was very scary for a lot of people. And some people just stuck their heels in the ground and says, hey, I'm not getting this vaccine. I don't care what you say and what you do. I'll take my chances. So it was
Right.
difficult. And so for us to really reach those people were amazing. To reach our
Mhm.
community, amazing.
Yeah. There were a lot of barriers that hindered, especially Black folks, from getting the vaccine, whether that was the huge incentive that the government put out, like, oh, if you get the vaccine, then we'll give you this amount of money, or like you said, historical legacies that, you know, came up again. And I know some people are like, you know, well, if I get the COVID vaccine, then I don't want to like get COVID or anything like that, or I don't want to get COVID or whatever. I'm like, well, think about the flu vaccine. You get that to reduce the susceptibility of getting the flu. You're not gonna be cured from it. So people also had misinterpretation of what the COVID vaccine actually did for you. So there's a lot of misinformation out there, and I think just I think there's a lot of work to be done to break down or to gain trust within communities when it comes to these kind of things, because that does ultimately, which is understandable, the barriers that are there, but it also hinders, the health and well-being of the communities as well. So finding that middle ground to gain that trust.
Can I add one other point?
Yes, of
Um,
course.
so I remember having this conversation with a marketing team that was gifted to us for a period of time. And we were doing COVID-19. And so we were doing some arms and shots in arms. And one of the shots in particular was the person could have been light skinned. The person probably might have been white, and was a black arm. I said, this is not going to work. And the marketing team was like very puzzled. I'm like, the last thing I want to see is a white person. And it's not about not liking white people, but just the concept of a white person, once again, giving a black person something.
Mhm.
And when there's not a lot of trust from the get, that's not going to go over very well. And
Right.
even though the marketing team really didn't understand, because it's the culture, and that's when the community-based organizations come through and say, hey, that's not going to fly. It's not going to fly for these reasons. And it has nothing to do with either liking black people, liking white people. It's the imagery that sometimes can trigger people. And then it came back to me, I can't find a black nurse or doctor giving an injection to another black person. I said, well, then we won't be using this image until you find one. And so it ended up happening. I actually had my daughter go out and go to one of our events and take a picture. And we used that picture versus the ones that the marketing team had. So it was a lot. We had to teach marketing, how to market to our population. Because some things just weren't gonna fly. And sometimes we had to create our own marketing material because it wasn't there.
Wow.
Yeah, and I was going to piggyback on that, so I'm happy, Ruth, that you jumped in with that, because I was going to say one of the things that COVID really shined the light on was the lack of Black medical professionals. And I know in our area, you know, early vaccination sites were like the University of North Carolina, Asheville, and Mayhack. And one of the things we said to them was, as we're trying to get our community to come out and get these shots, who are people that are volunteering and working there that look like them? And that should be the first person they see when they pull up in that parking lot and start through that door, if you're trying to build that trust. And so I think that really highlighted that we're not doing a really good job with our STEM programs to get people that look like us in medical professions.
That is right. That is true.
I'm looking for the amen icon. Is there an amen icon on this thing? Diversity in medicine. Yes, that's another whole conversation.
Yes, it is. It is. Okay, well, we're going to transition into the quick activity, but please continue to share your thoughts and perspectives as we get into each stage of the cycle. So community-led action and communications plans. Emergency pathogens hit the hardest in communities of color, again, due to structural racism and other determinants of health that we spoke about earlier that are often ignored and neglected. To adequately address these factors, we must consider the community's role and impact it has on the spread of emerging pathogens and other emergencies that present in communities. There needs to be an action plan implemented that addresses the steps that need to be taken when faced with new pathogen. The community leaders and stakeholders who will be leading the force when translating information back to communities and ways to mitigate the spread. Such action plans need to include community-based organizations, faith-based organizations, grassroots organizations, and other non-traditional organizations, for example, like homeless shelters. And so with the action plans, it needs to achieve a specific goal and have actionable steps that needs to be taken that's easily followed and tracked. You can go to the next slide. So there are 4 components to an emergency response cycle: mitigation, preparing, responding, and recovering. All of these, to be done well, need to be rooted in strong partnerships between communities and institutions addressing the emergency. Next slide. So we're going to get into the main, the core of this, which is community partnerships, which is mutual participation, mutual trust and respect, mutual benefit, and a just value placed on each partner's contribution at all stages of the outreach process. They are crucial for controlling disease outbreak and mitigating disasters. So COVID-19 really reconfirmed that we need to elevate community engagement and partnerships and build equity, trust, and sustain action and future health promotion preparedness strategies. And so using these strategies, it really enhances the opportunity for better health outcomes. There needs to be an understanding of community engagement practices before, during, and after a crisis. And like we said earlier, we need to establish a relationship before an emergency hits to have better outcomes. They need focus on objectives such as building communities' capacities to address social determinants of health, facilitating multi-sectoral collaboration, deepening access to community resources and information, and facilitating opportunities for civic participation as a means for promoting health. So again, community partnership really at that core as we're mitigating, preparing, responding, and recovering to emergencies. Next slide. So with mitigation, it measures that prevent an emergency. It reduces the chance of an emergency happening or reduces the damaging effects of unavoidable emergencies. This requires a worldwide collaboration to prevent the emergency of novel pathogens through preparation and planning, and also to recognize the emergence of a pandemic and how it unfolds. The only defense is to monitor and identify the pathogen sufficiently early and pre-establish mechanisms and practices to stop it from spreading, whether that's vaccines, having testing sites, accurate and truthful information. Emerging pathogens mitigation planning reduces the loss of life by minimizing the impact of pathogens, emergencies, and disasters. And this all starts with state, tribal, and local governments identifying potential emergency pathogens and other viruses, risks, and vulnerabilities that are common in marginalized communities, specifically Black and African American communities that are most affected. You can go to the next slide. Now I'm gonna pass it to Alan to start with the activity. Alan, are you there? Oh, we can't hear you.
I did myself again. Sorry about that. Hey, everybody. Well, first of all, I just want to thank Dr. Phillips, Dr. Fox, and Ms. Hall and myself so much for your comments today. I think one of the objectives of a session like this is to connect community leaders with a resource such as the Respect Center. So thank you, Dr. Wall and Brooke and everybody from these regional centers. And we've certainly heard from the field in North Carolina and Ohio. So we're running a little bit short on time, but I'd like to hear from other people in attending today in the audience. And why don't we start with doing a chat storm? This is a situation where you can, I'm going to pose a question, it's right here, and everybody kind of type in some things and we'll have kind of an ad hoc discussion. So the question is, given what you've heard today and your own experience in your respective organizations, what are the key activities that need to take place in terms of community engagement, mitigation, to ensure that we are prepared for a future outbreak? One of the themes I've heard a lot is trusting government officials, trusting the health department. So that might be one thing that the panel has brought to us that we can expand on today. And I'll just leave it up for y'all, just type some comments and we'll get going. Ms. Hall, saying plan now for the future. Absolutely. Fund CBOs. Absolutely. Yes. COVID has taught us explicitly that you have to connect with people or else you will never beat a health emergency. And how do we continue to leverage these connections that have been made? Brooke, from Respect, sticking with the public health government theme, they need to work more to put correct and up-to-date information out in real time. Yes, we talked about the misconceptions that the communities have dealt with and some really interesting stories. I appreciate everyone talking about smoking and drinking just went out. People were afraid, they got misinformation. They were doing that in my neighborhood. I know that's right. Brooke, too, it's hard because things change so much and so fast. That's a good opportunity today to look at your regional centers and get leadership involved with higher ups, people with government agencies. Okay, why don't we move to the third chat storm, if we could, because we're running short on time. Here we go. Why don't we pose this to our audience members too? What are some transparent and effective ways government officials, institutions, and media respond to emergencies in an accurate way? In other words, how could we have done better? being honest. Absolutely. One of the strategies I've heard is that we don't have representative communication and action and media. The white arm the white hand injecting a black arm. That's a classic image of mistrust from the legacy of Tuskegee and Henrietta Lacks and other things. How do we get the community to teach people how to communicate effectively and correctly? Brooke, please.
I thought this might be easier to say out loud than type into
Yes,
the chat.
ma'am.
So one thing that we do on the inpatient side in the hospital in many of our areas, like our oncology areas, pediatric areas, things like that, is that we have invited patients and families in on certain meetings that we have with our hospital leaders and hospital staff. And it's not always just leaders in these meetings. And that is really good because it gives patients and families a voice within the hospital to help set policies, procedures, to guide how we care for patients and guide things that we do. And we have their perspective. And I think that that's a really important thing that you can take out into the community as well, is inviting our community members into, you know, the quote unquote boardrooms when you have public health meetings or government meetings and things like that, and you have our community members there, and not just for a, you know, kind of TV event, so to speak, but, you know, actually having community voices within their discussions, and not just during a pandemic, but at all times, and kind of get that community voice at all times.
Thank you, Brooke. Anyone else want to come off mic? That's a great idea. We're running, we're going to shave the presentation a little bit because we're running short on time. Anybody want to shout out on representation?
I would just say we need to use our Black and brown fraternities and sororities, and particularly nursing sororities. I just attended a Chi at a Pie nursing fundraiser in Columbia, South Carolina. And I kept thinking, why aren't we using groups like that in North Carolina to, first of all, recruit nursing students that are Black and brown. This was a fundraiser for scholarships for those students, but also using them at health centers and doing vaccinations, et cetera, where we're seeing people that look like the community we're trying to serve.
Thank you, Dr. Fox. Absolutely. The Divine Nine, everybody knows them, right? The Divine Nine sororities and fraternities. In my experience, they're very interested in that. Anybody else, just come off mic, talk to us. Let's have some conversation.
I will add, Dr. Fox, I think that what you said was really important. Nursing in general is always a very trusted profession. I mean, year after year, nurses are always at the top when you kind of look at who are your trusted professions out there, and nursing always rates really highly at the top. So utilizing your nurses out in your communities is just such a fantastic idea. And there are so many nurses out there who want to get out in their communities and do things. And I think that's just such a great idea.
And one of the things we did in Asheville, or attempted to do as part of our Juneteenth celebration, was to hold a health fair, which we had recruited a number of African-American doctors and nurses to participate. Now, that event ended up getting canceled because the first night at the end of the festival, we had a community shooting, which then also highlights that when we're talking about health in general, and particularly mental health, all the gun violence and other violences we're seeing in our community. But we, I think we can embrace celebrations like that to also get the word out to community members that attend these festivals and things in that nature.
Thank you, Dr. Fox. I'm going to, for the sake of time, I'm going to hand it back over to my colleague, Acacia, and close us out on this section. Thank you all so much.
All right, thank you guys for that wonderful discussion. Sorry that we had to cut things a little short, but I love everything that everyone was sharing. So if you would like to provide us any feedback or any questions, or any comments or thoughts that you guys have after this session, please feel free to reach out to my personal email, or the feedback@ccphhealth.org. We'll be happy to answer any questions that you might have. It can be in general about CCPH, partnering with us, or just general information. Next slide. So we're going to take a few minutes just to do the post-form evaluation. It takes roughly 2 minutes or less to complete the evaluation. And then the first, well, since it's a small crowd, everyone that is part of a CBO, if you fill out the evaluation, you will receive $75. So we want to hear your thoughts and ideas on how we can better improve our educational experiences. So please take some time and see and let me know if you can access the evaluation as well once you open it. Can everyone access it? Okay. Okay, great. So we can go to the next slide. So again, thank you everyone for showing up tonight. Thank you for our guest speakers who are willing to take some time out of their busy schedules and share their thoughts, perspectives, and views on how communities and other entities can prepare for emergency before, during, and after it occurs. And so please visit us on our website. Reach out to me if you have any questions, and a recording and a summary report will be sent out within the next week or two. So be on the lookout for that. So share it with your networks. But again, thank you guys so much for showing up and being actively engaged in this session. So everyone have a great night, and hopefully we'll see you guys soon.